patients' engagement in their own care does extend beyond the doctor's office, and in fact, the best medical care in the world, particularly for a patient that has a chronic or ongoing condition, isn't going to make that patient well unless that patient is able, when they're out living their life outside of that brief appointment, to do the things they need to do to take care of themselves. And in my own personal life, one of the things that I saw through the example of my mother, who was way ahead of her time. She was an engaged patient before we were even talking in research, no less in the real world, about engaging patients. Did some very important things, including carrying around a list of the medicines that she was taking, when she took them, how many times a day did she need to take them, what doses, what form did she take them in. It turned out to be a really important thing that she had done, because at a very young age, before anyone would have expected it or could have imagined it, she had a stroke and was in a coma. And it was the fact that she had this list available to my father to provide to the doctors that enabled them in a crisis situation to know what are the medicines that she needs on board to manage her health conditions. It turned out that she was doing that before anybody was telling anyone to do it. Now the advice is that if you take prescription medicines, that you keep a list of what those medicines are and what doses you take. Keep that information on a piece of paper in your wallet or on your person. Because unfortunately, we just don't know when some crisis could happen, whether it's, in a car or walking down the street, or, in your home, and some kind of health crisis that results in you not being able to communicate or communicate effectively about your own health. I've actually encouraged all of my family members to begin to do this, to carry a list of the medicines they take. But also, I have 3 young children. I have a 9-year-old, a 13-year-old, and a 16-year-old. And fortunately for us, they don't have to carry medication lists, but I think they do need to learn by seeing the examples that my husband and I set when we're in medical visits with them about what does it look like to be an engaged patient, that it's okay. And I think it's a really wonderful and important model to set for our children.